Good morning, Mrs. Jones. So you've come in today because you've been experiencing breathlessness while you've been doing some simple activities such as walking your dog or going up the stairs. And you've been experiencing this for a while, but recently it's flared up a lot more and you've been coughing a lot more, wheezing, a lot more shortness of breath. And you want to just come in just to check if everything's okay. Is that right?
Yeah.
That's good because there could potentially be something wrong here. So if it's okay with you, we'd like to take a bit more of a medical history and try and see what's wrong. Is that okay?
Yeah, that's fine.
After looking at your medical history and comparing that with the symptoms you've been experiencing, I think it's quite likely you're suffering from chronic obstructive pulmonary disease, or COPD for short. This is a lung disease that affects the airways in the lungs and tends to cause long-term breathing problems due to poor airflow. COPD tends to affect smokers mainly, and smokers over the age of 35. Anyone with a PACU score of over 15, which is smoking a pack a day for 15 years, tends to be at high risk. And with you smoking for 30 years, one pack a day, that puts you in quite a high risk group. The productive cough you've been having as well over the last few years also shows that it's a chronic disease and not acute, and this is also suggestive of COPD. The breathlessness you've described when walking your dog or going up the stairs suggests a grade 4 level of breathlessness, and this is very suggestive of a lung issue as well. COPD is also characterised by flare-ups that people tend to get once or twice a year, often during winter when it's cold or if they get another respiratory disease. And that's something you've described you've been having recently as well, so that also adds to the idea that it's COPD. Thankfully, you've not been having any blood in your cough or any severe chest pain, so that makes it quite unlikely that it's any sort of lung cancer or anything that serious. So just to confirm it is COPD, we'd like to perform some lung function tests called spirometry, and we can use that just to determine the severity of the COPD and then to rule out potentially asthma as well. We'd also like to perform a blood test. This will help us to rule out anemia, and it'll help us to check for any genetic issues that may also cause similar problems. Would that be okay? During the lung function test, we ask you to take a deep breath in and then exhale as fast as possible into the machine. And when you were doing this, we were looking for two specific readings. We were looking for how much air you could exhale in the first second, and we call this FEV1, and how much air you could exhale overall in the breath, and then we call this FVC. By looking at the ratio between these two, we can assess just how restricted your airways are, and therefore make a confirmation of the diagnosis. Your ratio came back at around 60%, which is below the 70% threshold for a normal lung function, and this all but confirms COPD. Your FEV1, which is the amount you could exhale in 1 second, was around 55% of what we would expect in a healthy individual of your age and height. And for this, it suggests that you are suffering from a moderate level of COPD. We asked you to redo the test, but with taking some asthma medication called a bronchodilator. And if asthma was the issue here, then we would expect to see some improvement in the results. However, we only saw a small improvement in your case, so we can confidently rule out asthma. The results for your blood test also came back negative for anemia and any other deficiencies that could have been causing the issue, so that all but confirms the diagnosis as COPD. To help you understand what chronic obstructive pulmonary disease is, I've got a leaflet here with some diagrams and explanations on it, just to let you know what's going on. COPD is an umbrella term that refers to a few different lung problems that usually occur at the same time, and it's quite common with around 2% of people in the UK currently living with it. It mostly affects smokers and people who work around toxic fumes, like people who work in factories and things like that. And it's mainly made up of two different problems. The first one is called chronic bronchitis, and this is where the tubes between your throat and your lungs are inflamed. And this results in them narrowing and producing a lot of mucus. And this then restricts air movement in and out of the lungs. The other component of COPD is called emphysema, and this is where the small air sacs in your lungs that control the gas exchange between your blood and your lungs become damaged, and this results in it being harder for oxygen to get into your blood and for CO2 to get out of your body. It's quite likely that you're suffering from some degree of both of these. Unfortunately, COPD cannot be reversed or cured, but with the correct treatment it can be halted and a lot of the symptoms can be alleviated. COPD is a risk factor in a lot of other lung and heart diseases, so it's important to get a hold of this quickly to reduce that risk. The most important part of treatment is to stop smoking. It's the main cause of COPD and it's the biggest factor when it comes to halting the disease. Removing smoking alone will result in a huge improvement in the symptoms and just in general quality of life as well. I know stopping isn't easy, but there are a number of services available to help with this. On this leaflet I've got for you here, there is loads of contact information for one-on-ones and group support. I think it's something like 3 times more likely to quit if you take advantage of these services, so it's something I'd highly recommend. If you're struggling to quit directly, then I'd also recommend taking advantage of nicotine patches or nasal sprays. You can get hold of these online or from a pharmacy. I'd also like to recommend some pulmonary rehab sessions with a physiotherapist here at the hospital. These will involve a variety of things that help you with the disease. They'll focus on like physical activity that's tailored towards what you need. So in your case, maybe walking the dog up hills, climbing stairs, things like that. And they'll also provide some things like dietary advice and education about how to cope with the disease. And then it'll just help you living with that disease in general. You can also prescribe some medicines to help with the symptoms. We'll start with an inhaler pump similar to what you'd have used if you had asthma. This will contain some salbutamol, and this is a short-acting beta agonist. And what this will do is it'll open up your airways and help air to get into your lungs. If you ever feel short of breath, 1 to 2 pumps of that should help ease the difficulties, and then you can do that up to 4 times a day. That's all we'll start with, and then when you come back for some other appointments, we can adjust this. We can add some tablets or maybe change the inhaler to add some corticosteroids or something like that and adjust to your needs. Some of these medicines have side effects, so we don't want to just throw them all in. We only want to use the ones that we need, and then we can add them on every appointment. My final point is to stay up to date with your vaccines. COPD will predispose you to a lot of respiratory diseases like the flu, so making sure you have your flu jab every year is crucial. That's the plan for the time being. Do you have any questions about anything I've said today?
No, that's great.
Oh, that's great. So I'll book you in for an appointment in about a month's time. If it flares up any time between now and then, phone up, make sure you book an appointment, don't want anything to go wrong. Have a read through the leaflets I've given you, and if you've got any questions in the meantime, feel free to contact me and just fire away. Is that okay?
Yeah, that sounds great.
Brilliant. Cheers. Thank you.
Thank you.